Hello, everyone, and welcome. Thank you for joining me today for this information session on restaurants, viruses, and the new normal. My name is Sean Rollo, and I am the Technical Director for Orkin Canada. Today, we're going to discuss what COVID-19 is, its effects on human health and businesses, how we can help mitigate its transmission through cultural changes, the adopting of personal protective equipment, sanitation and disinfection, understanding what the difference is and how it applies to your business, using a professional service like Orkin's VitalClean disinfection service, and developing protocols with viruses in mind. So when we look at COVID-19, this is a disease that is caused by the SARS coronavirus 2 virus. The SARS coronavirus 2 virus is part of a family of what is known as coronaviruses. And these coronaviruses are not new. There are cases of animal coronaviruses back in the early 1900s and the first human coronavirus back in the 1960s. So this isn't necessarily a new type of virus. However, it is a new strain of virus that we're seeing. And of course, it's taking quite the toll on human health. If we look at some of these numbers globally, over 7.3 million people affected thus far, and that's as of today, June 10th, 2020, with over 414,000 people having lost their lives at a rate of almost 5.6%. If we look at the United States, the numbers are at over 2 million who have coronavirus, and unfortunately over 100,000 that have succumbed to it. Again, around a 5.6% death rate. Here in Canada, a little bit different. The numbers are much lower at 96,000, but the death rate at just under 8,000 is sitting at 8.2%. Now, why that number is much higher in terms of a percentage, partially because these numbers are actually quite small. It tends to skew percentages to be a little bit higher. I do think that when this thing has run its course, assuming that it will run its course at some point, and we look at the numbers, they will start to normalize, and we'll see it somewhere in the rate of what we're seeing globally. So for those that are out there claiming that this is just like a flu and it's nothing more than that, clearly the numbers are saying something completely different. If you compare these particular rates with that of the flu, these are 5 to 6 times higher than the death rates that we're seeing from the common flu. Something that we should all be taking quite seriously. The effects of the COVID-19 disease on businesses can't be understated. For most restaurants, it's taken a major toll on their ability to serve their customers as well as look after their employees. It's an unprecedented and extremely stressful time for everybody that's involved. And one of the most important things that we can do is minimize the potential for the spread of this particular disease. And how do we do that? When it comes to a virus, it's not that easy. So let's talk about some of the ways that we can help prevent transmission. And clearly, we can go to some extremes. We can go to the extreme of closing completely and not opening any businesses, which is what we had to do in the beginning stages of COVID-19, because there was so much that just wasn't known. And so whether by order of the government or electively, a lot of restaurants just closed their doors. And so on the one side, closing completely, doing no business is certainly an extreme. On the other extreme, having businesses open, but everybody's got to be in sort of a hazmat type of suit, not practical, not something that we're going to be doing on a day-to-day basis. But there are things that we can do that are in between these two extremes. And one of them is adopting some cultural change, adopting the way that we do things and doing it differently. So whether that's working from home, social distancing, going out only for essentials. When we look at this particular infograph on the left side of your screen, you can see there's a patient here on day 1 with COVID-19. And if they were to do no social distancing at all, going about their regular routines as they normally would, by day 30, we would have 406 people infected with COVID-19. Conversely, if they were just to reduce their interaction with people by 75%, so implement some forms of social distancing, and whether that is working from home or being at a greater distance from people when they are out and about, by reducing all of this by 75%, that one person would infect 2.5 people after 30 days. So a dramatic difference between the two approaches, and it's clear that the evidence shows the effects of this cultural change and what it can do to help mitigate the transmission of a virus like the SARS coronavirus 2. Restaurants are having to adopt new ways to go about opening up dining rooms, or if they do even open up a dining room. A lot of restaurants have elected to only do pickup or delivery or takeout at drive-through windows, but they're not opening their dining rooms. This particular restaurant is actually very close to where I live, and I do frequent this particular restaurant. On the left-hand side, this was before the COVID-19 outbreak, and you can see that the restaurant is got a lot of different tables. There's still a fair bit of space in between the tables, but it allows for a fair number of patrons within the space. On the right-hand side, this is after COVID-19 and after restaurants were permitted to open where I live. Totally different approach. You can see the tables are spaced out much further. There's directional arrows on the floor to ensure that the flow of people through the restaurant is in one direction, such that they're not coming in close contact with each other, they're not bumping into each other. A different approach. We're seeing some restaurants adopt plexiglass or dividers or ways to help prevent the molecules that come out of your mouth and your nose as you're breathing or speaking or talking, which seems to be the primary cause of spread of COVID-19, is through these particles from an infected person. So somebody who has COVID-19 is breathing, speaking, talking, molecules are coming out of their mouth and nose and getting into the air, and then somebody else breathes them in, and that seems to be the primary way of which this is spread. So by putting some sort of dividers in place, it helps to mitigate the transmission of those molecules from one person to another. So we're seeing it at individual tables, but also in between tables. There's an interesting case study that was done on a restaurant earlier in 2020 where it was open. There was a patient with COVID-19 sitting at the center table here in this graphic at the top. So this table with all of the patrons that are in red. Index patient A1 is the person that had the COVID-19 disease. The other people at the tables presumably did not have COVID-19, but shortly after dining at this restaurant had contracted it. And then they did a bunch of data pooling to try to figure out, okay, let's see how the dots connect. Turns out all of these people were at the same restaurant at the same time dining. And so the people at the far right-hand table, this is family C in the purple shirts, and on the far left-hand side, this is family B in the orange shirts. All ended up with some of their family members contracting coronavirus. Now, the table in the center, the red, clearly they're much closer to each other as they're talking and as they're breathing and speaking and whatnot. There's a lot of transmission of these particles back and forth. They're in close proximity to each other, and so the virus was able to spread. How it got to the tables on either side was a bit of a mystery at the start. It seemed, well, maybe as they were passing each other, maybe they saw each other in the bathroom, maybe there's all sorts of different theories that were out there. Turns out they've been able to bring this back to the air conditioning unit. So the flow from the air conditioning unit blowing across the tables was carrying some of these molecules. In addition, the air conditioner unit has to be able to intake air. So it intakes warm air, it cools it all down, and then it blows that air back out. So there's two directions of airflow. There's air headed towards the air conditioning unit and air headed away from the air conditioning unit. So in this particular case, these three tables, were in constant flow of air across all three tables. And this index patient, as they were talking and breathing and whatnot, was able to spread these molecules throughout these three tables. If you look at the image in the far left-hand corner at the bottom there, that's the layout of the restaurant itself, and you can see there's a lot of other tables in this restaurant. Interestingly enough, none of the other patrons at the tables that were not in the stream of this particular air conditioning unit, none of them contracted coronavirus. So if you do have a restaurant with a HVAC or a air conditioning unit or some sort of fan system, it might be important to take a look at how does that airflow go throughout your restaurant, and is there ways that you might be able to divert it from going directly across tables? This is something that I think would be well suited to investigate. Mitigating the transmission of a virus through adopting personal protective equipment or PPE, really important. When it comes to a restaurant, probably not going to be in a full gown or a hazmat suit, what we saw in a earlier image, but very practical to be wearing a mask, maybe a face shield, some gloves, something that I think we're going to see as a new normal when it comes to restaurant operation. Now, there's a lot of differences in the various masks that are out there, and it's important to understand them before selecting what is right for your business. Everything from a cloth mask, which is on the far left-hand side of this particular image, to a N95 or a KN95 filtered mask is going to work, and it's going to work differently. And there's a chart there that explains some of those differences, and I'm not going to go through all of them, but essentially when you're looking at choosing a mask from a cloth mask to an N95, as you move up to the N95, the filtration is certainly better when it comes to particles. Now, an N95 or K95 mask, which is that white filter mask on the far right, is usually used to filter particulates out of the air in environments like a wood shop or an auto shop, where there's a lot of contaminants that could get into your lungs. And it's meant to filter out 95% of those particles. When you look at a medical mask, which is in the middle, the surgical or medical masks as they're called, they're meant to help prevent particles from coming out of your nose or mouth and vice versa, which is exactly what we're trying to do here in terms of mitigating the transfer of COVID-19. Same with a cloth mask, but if a cloth mask isn't made correctly or out of the right materials, it may not have enough filtration. There are some really great websites that you can go to that Health Canada will recommend, or Center for Disease Control or the World Health Organization, on what materials to use and how to construct a mask or look for a mask if you're purchasing them instead of making them, what materials to use and how that might look. So before you go and purchase one, make sure that it's going to suit those needs. And if you're going to go with any of the other two masks, there's other things to consider. So let's look at what some of the challenges are in determining what mask is right for you or your business. Clearly, looking at trying to find these masks can be quite challenging, especially when it comes to a medical or an N95 style mask. They become extremely expensive due to two reasons. One, mask shortages, so it's driving the price up, but also the materials that are used to produce these particular masks, their price has also gone up. So a lot of different factors that are driving the cost of these disposable type masks through the roof. Something that may be impractical for day-to-day use in your business, you may have to resort to a cloth mask, but if you do, please make sure that it meets the requirements of your business. If you are going to look at masks, do you go with these disposables or do you not? Do you go with the cloth that can be reused? Do you go with the medical or N95 style mask for your restaurant? Most likely it's going to be a cloth or a medical style mask, not an N95. For two reasons. The N95 doesn't seem to have a lot of difference between it and a surgical or medical style mask in terms of the preventing transmission of COVID-19, at least according to the experts at CDC and the WHO. So moving to an N95 may not be required, and they are certainly a lot more expensive. So the choice is probably going to come down between cloth and medical style mask. If you are going to use a medical mask, it's deemed a disposable mask. Can you reuse it? Some great articles on the Center for Disease Control, as well as the World Health Organization, Health Canada, on the reuse of disposable masks. Can it be done? And if so, how to do so safely? I urge you to look at some of those articles of material before making the decision as to whether or not you will, in fact, reuse these particular style masks or dispose of them after each shift or each day. If you're not used to wearing a mask, it can be extremely uncomfortable. So medical professionals are used to wearing their mask. It's something that's just become commonplace to them. But for most of us, wearing a mask is foreign. It's odd. It feels weird. And so you're going to be touching your mask in your face probably a lot more often than you used to. And in doing so, you're actually increasing the risk of transmission. So getting used to wearing your mask and not touching it, not touching your face is going to be a challenge. Wearing it correctly, of course, is extremely important. It has to be able to fit well, has to cover your nose and your mouth, and it's got to be worn appropriately and used appropriately. I've been out in my day-to-day travels at the grocery store and other places, and I see people that are wearing masks, which is wonderful. It's great to see so many people that are participating and helping to reduce the transmission of COVID-19. However, if they're not going to use the mask properly, they might as well not wear it at all. There are lots of people that are wearing it and it's covering their mouth, but it's not covering their nose. Or as they go up to the cashier and the cashier asks a question, they pull their mask down off of their face, they ask the question, and then they put it back up. It needs to be used appropriately, worn appropriately, and fitted appropriately in order to work the way in which it's designed and be able to help prevent the transmission of COVID-19. When we look at restaurants, we are seeing an increase in use of PPE in this particular photo. The person at the drive-thru is wearing a medical mask as well as gloves. And as you can see, they're actually taking the tray and passing the food out in the bag on the tray and not touching the bag. So they're taking one extra step in ensuring that the number of people that are touching the bag or touching the thing that is going to be handed to the customer is reduced. Clearly somebody would have had to have packed the food into the bag, but did it need to pass over 3 or 4 different hands before it gets to the customer? This particular restaurant appears to be taking the approach of the less number of people that are touching the bag, the better. Let's get it from packaged to the customer with as few touch points as possible. When we look at dining rooms, there's a number of them that have started to open up. So depending on which province that you're currently living in, maybe your restaurants are open, maybe they're not, maybe they're about to. I can tell you that where I'm living, some of the restaurants are open. And when I do go into these particular restaurants, the servers are wearing masks. The person that's going to seat you at a table is wearing a mask. And again, this is just going to be commonplace and something you need to consider for your particular business. We need to talk about the differences between sanitation and disinfection. If we're going to mitigate the transmission, we have to ensure that we're doing everything possible to sanitize or disinfect appropriately. So if you're like me, you probably have interchanged these words quite a few times. And I know I did before COVID-19 came out. The differences between clean and disinfection and sterilization, there actually is a difference. So when it comes to cleanliness, there are varying degrees of cleanliness. So starting on the far left, clean is essentially physically removing germs, dirt, and impurities from your hands or from a surface. And so you can do that by using soap and water, and you're dislodging something from your hand, not necessarily killing it, but you're dislodging it. You're getting it off of the surface. When it comes to sanitation, you're actually killing. So you're killing at a 99.9% level. And that can be your germs and things that are on a surface. And that's with various products or cleaners that are designed for sanitation. Well, when it comes to disinfection, you're going one step higher. So instead of 99.9%, you're at 99.99%. And you might be thinking, well, wait a minute, that's really close. Like, what's the difference? I mean, we're talking very small percentage here. But when you consider the surface that we're trying to clean or sanitize or disinfect, in that very small space, there could be thousands, millions of virus molecules. And so a difference between 0.9% or 0.009% could be thousands or millions of molecules that are still left behind that weren't killed, which means that you can still be affected by it. So going from a sanitation to disinfection level is super important. Sterilization, one step higher. This is 100% of all living things on that surface are going to be killed. We think of sterilization when we think of dental instruments, medical instruments. These are things that can't have anything on it whatsoever. They're often associated with heat treatment of some kind, so they go into an autoclave and they're sterilized. There's nothing that's left living on it. Just not practical for day-to-day stuff. However, disinfection is. So when we're looking at products and services, we need to be looking at disinfection. That's the key. And so when we look at disinfection, there are going to be different types of products that are out there. So how do you know which products are right, or if you're hiring a company, are they using the right products? The very first thing you should do is consult with, if you're in the United States, consult with the EPA's List N, which is the disinfectants for use against the SARS coronavirus 2. This is, again, the virus that causes COVID-19. And here in Canada, you need to look at Health Canada's list of approved disinfectants for emerging pathogens. This particular list is pretty comprehensive of the various products that Health Canada has evaluated and deemed to be effective against this particular virus. Now, when you look at the product labels, if somebody were to sell you a disinfectant, or if you wanted to examine the product or the label of that particular product, it will not list the SARS coronavirus 2 on it. It's too new of a virus. It has not yet passed all of the testing and all of the various levels of government to be approved to be printed on that particular label. All of these things have been fast-tracked by either the EPA or by Health Canada. And it is reasonable to presume that if the product is effective against these other viruses or other coronaviruses, that it too would be effective against this particular virus causing COVID-19. So make sure that it's on this list here at Health Canada before you proceed with that particular disinfectant. It's also important to read the label of that disinfectant to find out, well, what are the active ingredients? What's the contact time? So when you look at the label, you're going to see on the front, it'll have a claim of, well, it kills 99.9% of this or kills 100% of that. But they're looking at it from a, well, on this particular fine print, it kills this. Every single product should have what's called a virus table. And this virus table will list all of the various viruses that it can claim to kill. Again, I can't reiterate enough that the SARS coronavirus 2 will not be on this particular label at this time. But you can look at other coronaviruses and have a reasonable estimate of what that contact time is. Health Canada may also list that. EPA certainly does on their list, and it'll list the contact time that's recommended for the SARS coronavirus 2. But you need to follow this contact time. So there might be a virus on the label that is a contact time of 1 minute, for example. But another virus might be 5 minutes, and another virus might be 10 minutes. So it's important to understand which virus it is that you're up against, and in this particular case, the one that's causing COVID-19, and you're using the appropriate contact time for that virus. It's also important to know whether or not the product has to be rinsed off of food contact surfaces after it's been treated. And it's especially important in an area like a restaurant. So if you've got dining tables, you've got serving trays, you've got food prep surfaces, all of these things could come in contact with food. And if they come in contact with food, they may need to be rinsed after they've been disinfected with these various products. So again, read the label. There are disinfectants that are good for no rinse, so they do not require to be rinsed off of food contact surfaces. And there are others that must be rinsed off. This is going to be a factor in your choice of disinfectants. And can it be applied while your business is in operation? Now, if we're talking about a small spray bottle that you're using on maybe door handles or the cash screens or something like that, maybe you can apply that while the business is in operation. But if you need to apply this disinfectant in a misting format or a fogging style format to get all of the potential contact surfaces in your restaurant, probably going to be a little unnerving for patrons and not something you're going to want to do. So you need to evaluate the type of disinfection and when it's most appropriate to do so. Again, disinfection, really important, that level above sanitation. When we think of sanitation, often we consider janitorial companies or sanitation companies, and that's their specialty. They're really good at it, but they may not be equipped or educated or trained on how to do disinfection properly. If you are going to do disinfection, is it something that you do in-house? Do you hire a janitorial company? Do you hire somebody to do this for you? Do you hire somebody who has experience with a professional disinfection? All very different from each other. This is where Orkin's Vital Clean disinfection service comes in. This is a service that's provided by professionals with a lot of experience with disinfection. And you might think, well, Orkin Canada is a pest control company. How does disinfection fit into their world? Well, we've been doing disinfection for decades. When you think about an infestation of, say, rodents or cockroaches or other pests, often when those pests are eliminated, the area needs to be disinfected, not sanitized, disinfected, to remove the pathogens that are associated with those particular pests and their carcasses. So we've been doing disinfection for a very long period of time, and we understand how to do it properly. The products and services that we offer are EPA and Health Canada approved. They do kill 100% of bacteria, and they will get to that disinfection level, that 99.999% for viruses. It is relatively low toxicity and eco-friendly. In fact, the EPA rates the product that we use during our service as practically non-toxic, so extremely safe. It's also not an ozone depleter. It's a crucial first line of defense. So when we're talking about reopening or keeping your business open, developing that sense of trust, getting that level of employee buy-in that you're doing all of the right things, disinfection is extremely important. We take it one step further to make sure that your customers, as they're walking into your restaurant, into your facility, that they feel safe and comfortable that you're doing something to help prevent the spread of COVID-19. There's a certificate that you can put on your windows or your doors stating that the area has been professionally disinfected by Orkin's Vital Clean service. Again, that peace of mind is really important. When you are looking at running a restaurant or getting your business back open again, protocols are going to be really important. You probably already have protocols in place for things like food safety. So if you're touching raw chicken, you're not supposed to then go and touch the cash screen right away. There's going to be protocols about what needs to happen in between. Well, you need to look at this the same way with viruses. So a protocol needs to be written to make sure that things are healthy and clean. You're looking at cleaning and disinfecting. You are social distancing, and how does that look like? What's the flow of traffic in your restaurant? Which door do the servers come in and out of? If staff are coming in and out of the restaurant, how should they enter or exit with viruses in mind? If your dining room is not open and you're doing pickup or delivery, how does that look like? You know, is there a waiting area that they can go to? I was at a restaurant not long ago where I went to go pick up some food. So I placed my order, I went to go pick up food, but the waiting area, the vestibule, was extremely small and there was only enough space for one person inside, but they didn't have a system for people that were waiting outside. And so clearly there wasn't a protocol in place for that particular restaurant. Really important that you develop a protocol and every single staff member fully understand every part of this particular protocol in order to help mitigate the transmission of COVID-19. So as we move through COVID-19 and we're seeing what this new normal looks like, what does the future look like? It's really hard to say, but one thing is clear: food-based businesses, particularly grocery stores and restaurants, are going to have to change their practices, and maybe forever. You know, how they go about things is going to be different. What does it look long-term for social distancing? Is this going to be months? Is it going to be years? I think there's going to be people that are going to continue social distancing long after COVID has subsided, simply out of fear that the next COVID, the next whatever it is, could happen. And so people are naturally going to be a little bit more distant than they were in the past. PPE is going to be part of everyday life. I think that in terms of restaurants and grocery stores and places where people are interacting frequently, the use of PPE is going to be much more common. Sanitation and disinfection are not the same. We can't state that enough. It's important to understand that disinfection is the level of cleanliness to which you need to be aiming for. And you should be contacting a professional company and having them do some professional disinfection services. Protocol should be made with viruses in mind. Extremely important that every member of your staff understands what those protocols are and that they follow them to the T. I thank you for your time today in learning a little bit more about restaurants and viruses and what the new normal might look like. Again, my name is Sean Rollo. I'm the Technical Director for Orkin Canada. I've got my email address here up on the screen, and you can reach out to us at 1-800-800-6754 for any questions you may have about our Vital Clean disinfection service or any other pest control related services that you may need.